So how many of the people in the audience have some understanding of AI? Very few. So probably I'll spend few minutes on AI. So that's what I lead a research lab, Accenture Research Labs, and artificial intelligence has been one of the areas I've been working on past few years. So before I go to artificial intelligence in healthcare, let me just talk briefly about artificial intelligence. And for many of you for whom it's just a word, it's actually a set of tools. It's not one thing, right? And it's a set of tools which allow you to build systems which can sense, which can comprehend, which can respond, and which can learn. Now let me try to explain to you each of these components. When I say it can sense, for example, the systems can understand you when you're talking. So you know, many of you might have seen conversational agents. You can talk. In fact, just outside there's a booth where they're showing the nuanced dragon, right? Where when you talk, the system understands you. It checks behind a database of medical terms to make sure it is picking it up in the right context, and then it is converting it to text. In fact, these technologies, you know, you can bunch them, a set of these technologies, you can bunch them as natural language processing. So what it really means that these systems are able to understand the way we naturally interact in the world. They can understand our writing, they can understand the text in the books. So you can actually give a book to the system and say, hey, extract, this is a report of adverse drug reactions. Can you really find out how good the drug is? Did people report any adverse drug reaction? Extract it out and tell me. Now this system is able to do it because it's an intelligent system, right? So it can be text, it can be speech, it can be videos, for example. Speech, you know, it will be able to understand what are you talking. And then what we call natural language understanding. What is the intent behind it? So as you ask various questions, it is able to understand your speech, it is able to understand the intent behind the speech, and then it is able to respond appropriately. And the other thing that is very important to know is that these systems are not static, they learn. So as they get exposed to more and more data, they learn and they become even more intelligent, right? And you'll again encounter terms like machine learning, and you'll encounter terms like deep learning. And you know, we won't go much into details because there's a way the learning algorithm happens. There's something called supervised learning when the human beings are training the AI systems. So that is your you know, kind of a high level preview to what is AI. Okay. Now I do have a deck, and okay. Now I don't intend using the deck or the video much unless it really helps you to get the concepts a bit. Now let me look at the healthcare context and see what are the opportunities for AI here, right? Personally, I see two big shifts happening, and that is our traditional healthcare system has been designed to kind of tackle diseases, right? To manage diseases. And that's what the healthcare system has been. It is totally illness focused. But over the years, as countries like India got westernized, the kind of diseases have been changing. So I think 61% of the deaths are because of non-communicable diseases, like cardiovascular diseases, for example, diabetes, for example. And the characteristic feature of these diseases is they are preventable, right? So if you can prevent these diseases, then these people are not going to end up in hospitals, right? And the hospitals, for example, they are understaffed. They are already not able to scale up. So globally, the focus therefore is in what is we call shifting from illness to wellness. So you are looking at a person not just when he is sick, But even when he's well, and you're creating an entire data supply chain of that person, and I'm sure many of you in this room are having wearables in your arms. So all of these are generating a lot of data, even when you're healthy. Now, when you take this broader view of wellness and illness, you have to rely on technology such as big data, and you also have to rely on making insights, analyzing, getting the right insights from this big data. You have to connect the dots, right? So AI becomes an enabler, an important enabler when you want to look at this big picture. Interestingly, just last month I was in Austin, Texas, and I was talking to the Dell Medical School, which is at this point defining the healthcare system of the future. And many of you who are curious, you can go to the website and check it out what they're doing. I was talking to Dr. Bill Turney, who is leading this whole effort, and they are calling this healthcare system as population health, right? And the interesting bit here is you're not only looking at the healthcare data of patients, you're even looking at welfare data. For example, the reasoning goes like this, that you have a patient, he comes to the hospital, he gets treated, he goes back to the outside world, he again becomes sick because his conditions have not changed. Maybe he's unemployed, maybe he is not having access to good food, maybe he's not having access to good sanitation, you know. And what attempt is being made is to create this huge big data environment where you pull in all this data, and then you need to connect the dots. And what do you need to connect these dots? You need artificial intelligence, you need analytics, AI, to connect these dots, to say, okay, this is a group of people who are falling sick. Why is it so? Is it because they don't have, in an Indian context it can be, is it because they don't have proper sanitation? Should they be connected to the Swachh Bharat program so that they don't fall sick again and again and come to the hospitals? So that's a big picture where AI can help. But in general, you know, what can AI do for you? AI, as I said, can promote wellness, and that's what I gave you an example. AI can help early diagnosis of ailments. And there has been a lot of interesting research happening. You know, my friend just showed a smart mirror. And you know, you will have this kind of smart mirror every day morning. When you get up and you brush your teeth in front of the mirror can actually predict whether, you know, from your image, you know, if there's anything, any sign that seems to indicate that maybe you're passing through a very stressful time. Maybe it can even indicate, hey, you need to take a break. There's something happening in NCPA and you will like to attend that because that's your area of interest. You know, you need to lower down your stress levels. So you will have this kind of smart environments around you. There are, for example, smart toilets being built where every time you flush the toilet, you know, you may even get an SMS to say the sugar level in your urine was very high. Go and talk to the doctor, right? And then you have all your smartphones with all these interesting chatbots, and these chatbots can be used. And these chatbots are already there, for example, but these chatbots are going to get more and more intelligent over time as they learn and they refer to more intelligent knowledge stores. So these chatbots will be our first level of consultation at the edge, even before we go to the hospital. And I was looking at one of the booths here on Apollo, probably it was Apollo Ask or whatever. So that app is helping today to just set up consultation with somebody, with one of the doctors in Apollo, the right specialty, and the mapping between the patient's ailments and the specialty is apparently being done by an AI algorithm in that app. It's just outside the booth, if you can check it out. So you'll see this kind of application of AI where you'll see conversational agents, you will see, you know, people, WebMD, or there are many such out there, and they will be increasingly getting better at predicting or diagnosing. And then, obviously, they won't be as good as the doctors. But then, at a point, they can even tell you that you need to go and check and consult a doctor. And if you do go to the hospital, for example, there will be AI everywhere. AI is pervasive. It will be all over the place. The hospital systems, for example, can make sure your wait time is reduced, because a lot of people end up in OPDs waiting long hours. The hospitals can, for example, have intelligent algorithms where, typically as a patient, when you enter the hospital and you see 50 doctors' name in front of you, as a patient, you start thinking, who should I show myself to? Should I start with a general physician? Should I show an MD? Should I, maybe I go to an orthopedic? As a patient, we are always confused. But if your medical records are there, the AI systems can probably map your ailments to the best doctor and tell you, you should be talking to this doctor. So you can see use cases all over the place. And then, as I said, there's so much of natural language processing that we need. And every time I went to a hospital for my dad, even after he was released, I used to sit for 3 hours for discharge, because they are doing the paperwork for insurance, Mediclaim. Now with NLP, you can crunch those time as well. In fact, some of the AI techniques, like Dragon, for example, have been reported to reduce the administrative work that doctors do by, in one of the research we did in Accenture, by 17%, and the nurses by as high as 50%, because there's a lot of paperwork doctors have to do which they don't like at all. So that, again, a lot of AI use cases there. And imagine you end up going to the hospital. The doctor is now an augmented doctor. Now the AI is the whole game of mind and machine. So the doctor, whether when he's doing diagnosis, he can have systems which assist him or advise him. For example, deep learning, it has been established in many scenarios, its accuracy of detecting images is much higher than human beings. So when you have a radiology report and the doctor is looking at it, deep learning algorithms can point out something there and say, this looks like a tumor or an anomaly, and you just bring the attention of the doctors. So I don't believe that AI will replace doctors, but AI will definitely augment them and make them much more effective and make their lives much better. So from helping in the diagnosis, if, for example, the conclusion is the patient needs some procedure to be done. Again, with what we saw, augmented reality and AI, the doctors can actually simulate the complex procedure before actually doing the procedure. And when they try to do the procedure, again, you can take help of robotic surgery and many things, right? So you can just imagine that healthcare is a rich field where you can just do so many things with AI. And then I'm not even entering the area of life sciences. But when you enter in the area of life sciences, you have genomics. You have nowadays CRISPR, which allows you for gene editing. And then you can give very personalized medicines to your patient. So, and finally, when you discharge the patient, you don't want the patient to be occupying your expensive ICU beds. You want the next set of patients to come in. And then you can have something like a vitals monitoring system. We did a research in the lab a few years back, and we have implemented it in a couple of hospitals. And these vital management systems are very cost effective. You go home and some of your vital parameters, respiratory rate, your oxygen level in the blood, your heart rate, your body temperature, they get continuously monitored. And then there are machine learning algorithms in the cloud that analyze it. And if there's any aberrations, any indication that the health is deteriorating, there can be message sent to the healthcare provider or the patient. So again, very good for the patient and also good for the hospitals, because they have limited resources and they want to make it available to more and more patients. So, as you see, healthcare is an information business. It's all about having the right information of the patient, analyzing to get the right insight about the patient, and then giving the right personal care to the patient. What I will do, because my friend use 2 minutes less. I'll play one small video of a small video that of elder care, right? And this video we showed as recent as last week in Las Vegas with the Amazon reInvent. So the Accenture elder care, if you can see, it will show you how all these new smart devices will make life good for the elders. Make sure that they are able to be effectively, happy, and they take their medicines and everything.
I don't want to be as I can for as long as I can.
We've all seen the headlines. The UK is facing an aging population time bomb. The population over 75 is projected to double in the next 30 years. Care homes are undergoing a funding crisis. Their numbers have been decreasing over the last 5 years. The care homes that are left have been struggling to find and retain staff, impacting the quality of care provided. On average, care homes today cost over £900 a week. Needless to say, most of us want to grow old in the comfort of our own home, close to our friends, family, and to the community that we've been part of for many years. Growing older allows people to take the opportunity of finally having the time to get closer to our loved ones, learn new things, stay active, and make new friends. Accenture and Amazon, advised by Age UK London, are introducing the Elderly Care Pilot. Created to complement real-world care, it's helped serve older people's needs through the power of voice alone. The Elderly Care Pilot helps older people improve their physical and mental well-being in a number of ways. Easier access to reading and learning materials, plus daily exercises that they can do at home, are just a start. More communication options allow people to stay in touch more easily and frequently with friends and family.
Okay, so I'll not play the whole video, but devices like this will be there in our lives. They will prompt you when you are not taking your medicines. They will make sure that you are connected with the community, which is as much a part of the healthcare, for example, because when you are having a better life, the chances that you will fall sick is less. You'll be in a better health and probably won't need that much of a healthcare as well. So thank you so much.